The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, cosmetic dentist Dr. Guy Lewis gives his patient renewed confidence with her new smile. ENT Dr. C.T. Wynn talks about a procedure called balloon sinuplasty. Bariatric surgeon Dr. Scott Stowers gives us an overview of My Bariatric Solutions and their philosophy on patient care. Plastic surgeon Dr. David Altamira gives his patient the looks she's always wanted. Vein specialist Dr. Peter Morgan discusses his methods for treating those with restless leg syndrome.
I decided to get veneers because when I was younger, I fell in a skating accident and chipped my front tooth. Had to get bonding done on it. So over the years, bonding stains and discolors. So when I started working for Dr. Lewis, I really didn't know all my options. I had really only talked to dentists about doing the bonding.
Well, Christine's been working with me about 9 years, and she had worked for a plastic surgeon before, and so she had been involved in the beauty industry, and she came to work for me, and she has been a great asset. She's great. She understands what we do. She can communicate with patients well, but she wanted to change her teeth as well. She had had some bonding done in the past, and they tend to stain. Bonding is an acrylic material that tends to absorb stain and change color over time, so she wanted to make them look nicer. And she's a real pretty lady, and so I wanted to give her a real bright smile that would accent her look.
We discussed crowns, full coverage crowns for all my teeth, or veneers being more conservative, and I like the more conservative approach on my front teeth, so we went with the veneers.
Well, veneers are very thin shell, kind of like a contact lens of porcelain that goes over teeth. Another analogy would be kind of like a fake fingernail that you'd put over your fingernail. And they are made to change the shape of the teeth, change the color of the teeth. Then we're putting the veneers right over their tooth, and so we don't have to reduce the tooth in any way. And then I just smooth it up very gently right around the gum line, and most of the time there's no irritation to anything. So we do it without numbing and without drilling on the teeth. They're very thin and delicate before they're bonded onto the teeth. Once they're bonded onto the teeth, they become very hard, and they last a long time. I've had veneers I've done on patients 30 years ago that are still doing great.
I love my new smile. Dr. Lewis truly is a miracle worker, and that first impression is a lasting impression, and I think a great smile is worth it all.
Our bodies need at least 90 milligrams of vitamin C per day. The best way to get all your vitamin C is by making sure to eat at least 5 servings of fruits and vegetables every day.
Originally, I was having
So it becomes enlarged and inflamed when it is irritated by either allergies, infection, or pollution in the air. Considering her busy schedule, we decide upon two-prong approach treatment. Balloon sinuplasty in office to treat her sinus issue, and inferior turbinate reduction to relieve her nasal obstruction.
I don't really have any more sinus issues. I haven't had a sinus infection since the surgery, and it's been a few months now.
The advantage of balloon sinuplasty is that it can be done in office. There is no general anesthesia. The cost is less than doing it in the hospital, and the recovery time is really quick. There's really no downtime. The patient can go back to their daily activities quickly.
It's actually kind of funny. There's a lot of things that I didn't realize were issues until after the surgery. I know one time I was sitting in my bathroom and I was sitting there and there was a candle about 2 feet away from me, and I actually could smell it. And that was something that I have never done before, and it kind of just hit me. I was like, you can actually smell the candle.
Find your doctor on bestdocsnetwork.com.
We are excited to have in the Best Docs Network studio Dr. Scott Stowers of My Bariatric Solutions, not only one of the top bariatric surgeons in the state of Texas, but around the United States. Welcome to the program, and let's get right to it. What makes My Bariatric Solutions different from the rest?
Every patient that comes through the door sees me. I evaluate every single patient individually to see what they need and what will work best for them. Every patient is followed all along the way with several of my staff who specialize in different aspects of their care.
There are a few different types of bariatric surgeries you can perform.
We do lap bands, we do sleeves, gastric sleeves, we do gastric bypasses. We also do a revisional work where we change bands to sleeves.
You know, I think that what is very interesting is before you actually were a general surgeon, but you changed over in order to help people. How come?
Most of the work that I did as a general surgeon was the people were either obese or they were smokers. We were always fixing things. It was a cause and effect. So what I learned from that was I wanted to get on the other side of this. I wanted to prevent things.
Now, when an individual comes to you and they are not happy with themselves, what's the first step?
We look at the different aspects of their life, the different health problems that they may have, the likes and dislikes of their different lifestyles for each individual. And then we try to fit the surgery to that individual that's going to work the best for them.
One of the reasons why you changed from general surgeon to bariatric surgeon is because you see the results. You see yourself changing people's lives. What kind of feeling does that give you?
That's the reason I'm here. That's the reason I do what I do. This totally changes the end result of what people do, the end result of what their life's going to be, and it's the most gratifying thing that I think anyone can do.
All right, Dr. Stowers, appreciate the time. Dr. Scott Stowers of My Bariatric Solutions.
Ken has a question for Dr. Lindsay Arvizo. Why do I frequently lose my voice?
People can lose their voice frequently for many reasons. It can be from an actual lesion on the vocal cord, or a traumatic injury to the vocal cord, or they're just using their voice incorrectly. If anyone has had vocal issues or hoarseness for more than 2 weeks, they should be evaluated by an ENT physician and have their vocal cords evaluated.
Ask our doctors on bestdocsnetwork.com.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple. And I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process. And he said, you can always do more, but let's do something modest for now. And just overall really comfortable.
First, we talk to the patient at length. We ask them what they like about their nose and then what they don't like about their nose. There are certain things that we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually a lot of times just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
Sunscreen is unlikely to stop you from being sunburned or reduce your risk of skin cancer if it is not applied properly. Most people do not apply it correctly and stay out in the sun too long. Be sure to put plenty on and reapply often.
Well, I had some reoccurring wounds on my legs that just wouldn't heal. It seemed to be worse in the wintertime. Well, I had had them probably on and off for a couple of years, but it seemed to have gotten worse in the end of 2011.
Many of the patients that we see that have wounds have had them for many years. On several occasions, we've seen patients that have had wounds more than 20 years. They typically are getting seen at wound care centers or getting treated by a variety of other healthcare providers without success. These wounds occur on the legs. They are frequently very painful. They are not associated with diabetes, which is a common misnomer. They're caused by venous insufficiency or varicose veins.
I had gone to a local hospital, to a wound center, and spent about a month there doing different things, going back every week, and it was no different. And I decided I was just wasting my money there, so.
He came in, we performed a venous Doppler ultrasound on him, diagnosed venous insufficiency. We corrected that venous insufficiency on him using endovenous radiofrequency ablation of the vessels, and all his wounds healed up very promptly, less than 2 months. In fact, some of them were healed within a couple of weeks.
He seemed to have a little bit, better idea what it was. It was a circulation issue as far as the veins, and he talked to me about the different veins that they could do as far as the closing off of things, and I was all for it. He said that he thought it would heal up within no time, and he was correct.
Treating those veins results in relatively rapid resolution or healing of the wounds. Probably the #1 reason why I began to specialize in the treatment of venous insufficiency was that I discovered that it was the solution to these chronic wounds that had previously not been treatable.
Seeing Dr. Morgan, he was very personable. He's easy to trust right off the bat, knew what he was talking about, very friendly staff. Like I said, I've never had any issues since, and I've been very happy with the experience.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Clinical psychologist Dr. Collins Hodges talks about how he works with the entire family to treat behavioral problems in children and adolescents. oral surgeon Dr. Paul Metz reconstructs his patient's jaw. Houston Northwest Medical Center highlights their nurses' commitment to patient care as well as to their community.
Well, today we're having the 2015 Montgomery County Go Red for Women Luncheon.
The theme of our event is American Heart Association Goes Bollywood.
This is just a fantastic event and great resource for women in Montgomery County.
Heart disease is the #1 killer of women in this country. More women die from heart disease than men. But women don't know that. The American Heart Association and the American Cancer Society have really done great things to teach women about these two illnesses.
This is just a great event for women to come out, learn about how they can, in essence, take the bull by the horns and get their heart health under control. They can learn resources about how they can keep their cholesterol in check.
At the booths, we are educating them about prevention, awareness about heart disease, what it takes to really know if you have plaque production in your carotid arteries, or if you have what we call endothelial dysfunction.
We had several awesome speakers. We had Monette Smith, who is actually the CEO and publisher of Review It magazine. She has an amazing story about how she noticed she had the warning signs and symptoms of high blood pressure and took a proactive approach to take care of her life so that she could be there for her children and leading a heart-healthy lifestyle.
My personal journey was an awakening call for me. I came here to be the keynote speaker, to not only share my story, to educate women who are going through the same thing, to recognize that when you are having symptoms, get checked. 1 out of every 3 women are suffering or living with some sort of cardiovascular disease. And oftentimes, we dismiss and don't take care of ourselves as women.
So we have this amazing fashion show this year. The twist is that we're gonna actually have the survivors walk out with their doctors. These are the doctors that have had a hand in saving their lives and making sure that they are living free of cardiovascular disease and stroke. So this is just amazing. It really shows the wonders of the AHA and the hand that we play in our communities.
We're hoping to be the biggest event in the country and to raise awareness and raise money for research and really breaking barriers and going beyond the standard.
Request an appointment on bestdocsnetwork.com.
Taking a break with a change of scenery or change of pace is good for your mental health. Simply take a 5-minute break from your household chores or a 30-minute lunch break during your workday, and those small breaks are enough to de-stress you with a fresh mind.
Let's talk about gluten sensitivity. You hear a lot about that. People with gluten sensitivity tend to get bloating, gaseousness, but it also can cause things like anemia or fatigue because it washes out your nutrients in your body and causes changes in everything from your energy level to your tests in your doctor's office. Gluten sensitivity is caused by the absence in your small intestine of an enzyme that digests gluten. Gluten is like wheat, breads, and that kind of thing, and starches. If you don't have that enzyme, you build up gas from all the gluten that we tend to get in our diet. How can you tell if you're gluten sensitive? Well, one way is to just take gluten out of your diet. All you have to do is look on the internet and you'll find gluten-free diets. If you get better from your symptoms that worry you by being on a gluten-free diet, then you probably do have gluten sensitivity, and just keep on keeping on that way. Now, one way to tell for sure is you can get a biopsy done in a doctor's office with a scope down your throat, but that's not the best way to do it. Just get a blood test done if the dietary restrictions don't work.
Behavioral management is all about changing negative behaviors. My goal is to promote healthy families. We're here to promote healthy relationships. I work with parents to identify specific problematic behaviors. When parents come in and their children have behavioral problems, the first thing we want to do is target any stressors that are going on. And number 2, identify what those behaviors are. Once we've identified those, I want to really get together with the parents and see how parents are implementing consequences to those behaviors. For example, we want consequences to be specific, immediate, consistent, and we want them to be meaningful to the child. We want children to feel like they're being recognized and noticed and reinforced for positive behaviors, ideally more often than the negative behaviors. We want children to feel good about their interactions with their parents. And parents want to feel good about their interactions with their children. There's a lot of emphasis I place on establishing trust, really getting down to understanding how the child perceives his or her problems. What is it exactly in his or her world that is giving him or her difficulties? The core of setting up a behavioral management program is setting up a behavioral contract that links wanted behaviors with privileges, and working together as a group to create kind of a scenario in which there's an outline for success, and it's something that can be checked on a weekly basis at home and then in the office. My goal is to promote healthy relationships between parents and their children. It's about kids feeling good about their relationships with their family and their friends. And same thing for the parents. I want them to feel good about the interactions they're having with their kids.
Linda has a question for Dr. David McGee, who is considered a high-risk patient for colon cancer.
What we consider high-risk patients are patients who primarily have a family history of colon cancer. That would include a patient with a first-degree relative, such as mother or father or brother, who developed colon cancer, or a complex colon polyp before the age of 60. Or if you have more than one direct family member with colon cancer at any age. They should begin at age 40, or 10 years earlier than the youngest family developed colon cancer. There are some certain diseases, such as inflammatory bowel disease like ulcerative colitis, that also start colon cancer screening earlier.
Ask our doctors on bestdocsnetwork.com.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face, and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion, and it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
After a workout, don't eat carbohydrates for at least an hour. Your body will be forced to break down body fat rather than use the food that you have ingested.
At Houston Northwest Medical Center, we're immensely proud of the wonderful group of nurses that we have at our hospital, not only for the care they give to our patients every day, but also for the way that they've reached out and become so involved in our community.
Their commitment to the patient here at Houston Northwest is amazing, but in addition, above and beyond these four walls, they carry it out to the community. And that's evidence in all their volunteer work, through runs, through patient support groups, through educational opportunities they offer to the community.
One of the reasons that I really like working for Houston Northwest is its philosophy, its commitment on giving back to the community. And so when an opportunity came up from Spring Independent School District for me to be a part of their education foundation, the hospital was very supportive in not only its financial resources, but allowing me the time to be able to participate at a high level of engagement with our school district.
Race for the Cure has become a really important tradition here at Houston Northwest Medical Center. Living the walk with these ladies, they allow you to walk beside them, behind them, in front of them, holding their hands. That's very important. That's something you cannot buy or you can express in words, really. I'm very honored. I am honored to be part of their lives and do whatever I can to help them along the way.
When I first started working here is when I got involved in the Heart Walk just as a participant. And after just participating for a couple of years, they asked me to kind of take it over. And so now that's what I do, is I help raise money for the American Heart Association Heart Walk.
Relay for Life is the biggest fundraiser sponsored by ACS. So American Cancer Society is always collecting donations to go towards patients that are underprivileged or that need resources when facing their diagnosis. It's humbling because I get to see patients come in that get a diagnosis that is life-changing, and then to be able to see them walk around the track as a survivor or one of their family members to walk around the track in remembrance of them. I feel lucky that I get to be the person to represent our hospital in that.
I love my job. It's fun. It feels good to be helping people live a healthier lifestyle.
Obviously, we're very proud of the quality of care that's provided at Houston Northwest Medical Center, and our nurses are the driving force behind that. But their commitment to quality care and their commitment to our community extends well beyond the walls of our hospital through the many charitable and healthcare awareness events that they participate in actively throughout the year.
I think that gets to the core of nursing here. There's a heart, a big heart.
Sunflower seeds can help protect your heart. Consuming a quarter cup of these seeds delivers half of your daily value of vitamin E. Vitamin E helps keep your heart healthy and fights infections.
Watch more videos on bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.